welcome to all. We are from the Aster Pediatric team and myself Dr. Sindhu.
I am Dr. Nanditha.
We are Paediatric Intensivist at Aster RV Hospital. Today we are talking on a very exciting topic, that is the Summer Maladies in children. So what is Summer Maladies? This time Bangalore is especially hot. So let's see and discuss what are the problems that are associated with this summer season.
Coming to the next topic is the various stings and bites we see commonly in children. Why does this happen? Children love to go outdoor and play in the park, and sometimes even in the play area, especially later in the evening, they will end up having these stings and bites. So Dr. Sindhu, what are the common bites and stings will come on children?
Yeah, I agree with you, Dr. Nanditha. Now, this is whenever the children are playing, they're more prone for the bee stings or the wasp stings. So first, how do we recognize them? And whenever the child complains of this, the first look at the area of the bites. If you find any sting, try to remove the sting, but don't never ever squeeze this wound. All you do is take cards, especially your ATM cards, and try to just scrape the skin so that the sting comes out. Once the sting comes out, all you have to do is don't apply any medications like any astringents or anything. Just give paracetamol for the pain and hydrate the child well. If there are certain danger signs, when you have to go and see your doctor, that is when there is an anaphylaxis. What is anaphylaxis? If the child complains any breathing difficulty, or if you find the swellings around the area of the mouth, or the nose or the mouth, the lips have become swollen now, or the child complains of any vomiting or tummy pain. Now these are the danger signs whenever the child has stings. So whenever you anticipate this, immediately see your doctor, because this can be a life threatening. The child might need an adrenaline shot. Now next, coming to another common thing that we come across are the dog bites that we see. So don't ever provoke the street dog. That is the most common what the children tend to do. Suppose a child is being exposed to a dog bite, don't immediately tie the area, or all you do is take to the baby to the bathroom and just clean the area with inadequate water and soap. Wash the wound thoroughly and take the baby to the pediatrician, because the child will need the anti-rabies vaccine, and depending upon the type of wound and the location of the wounds will be categorized into different stages. So based on that, they might need further injections like immunoglobulins.
To add to this, especially children who are playing in the rural area and in their gardens, they might be prone to snake bites and even scorpion bites. Snake bite, how will we even identify if it has happened or no? It's wise to look for the fang marks. Sometimes children might just have some vomiting, they might have altered sensorium, tummy ache. All these are the commonest symptoms. If we come across these symptoms, it's better or at the earliest to seek the nearest medical center and do the first aid for the children. In the meantime, at home, please do not tie any cloth or a tourniquet very tightly around the wound site. Please seek medical attention at the earliest. Similarly, scorpion sting also, children might just end up crying excessively. We might not even know the scorpion bite has even occurred. So, in those times, it is better to always go to the medical practitioner and get the child examined and seek medical attention.
Adding to what Dr. Nanditha has said, there are a lot of misconceptions, especially with regard to the snake bite. They might have seen in some movies or the TV and the media, and all this thing lead to some unscientific practices that what they follow. So whenever we anticipate a snake bite, it could be venomous or non-venomous, that means poisonous or non-poisonous. So all you have to do is don't panic, call for help if available. If not, try to immobilize that particular limb. That is, suppose the child it's bitten over the limb. What you do is just the joint above that and the joint below that. Just try not to avoid extra movements in those joints, so that if the more joint movements are there, then the venom can spread fast. Another common mistake what people do is they try to suck the blood out, thinking that they are going to remove the poison. This does not help. In fact, you are getting the person who is sucking also at danger, and also the baby who's been bitten, that baby is also in danger. Another common thing what people do is they tie a very tight so either a rubber band or a cloth just above the bite side, thinking that the venom does not spread. Even that does not help. In fact, that adds on to the more injury, the tissue injury, and once the tourniquet is removed, the whole of the poison can just gush into the body and again it causes harm. So kindly avoid doing this unscientific methods.